See that nose. After a cosmetic rhinoplasty, this was a male nose job we've just done. So you can see the tip. Show you some other views. Defined nose. There wasn't hardly a tip to say, no radix. Now we've given him a nose with a lot of definition. Rib harvest was needed. We're going to show you the basal view as well. This is the correction.
To satisfaction, but then
just to make sure. Hey, Dr. Sara. So this fellow's teeth setting will be done today. Finally, they give. Painful, yeah, I know, sorry.
The speeches area.
Yeah, because it's just 7 days, right? So some patients a little bit bruising and things like that. Yeah, it shows things on. A lot of improvement, right?
A lot.
So you can see the.
Yes.
So we've basically thinned it out everywhere, augmented it there all the way, then narrowed it there, made it like a triangle, and your tip was really bulbous. We're going to show you other views also. So like really bulbous.
Yeah, from the bottom.
Yeah. Now you can see. Look towards me, like this. So just see that. Maybe a little bit more like that. Yeah. Trying to make you turn.
And then it was not on shape. You see there. Then that has been really, improved.
Look at that.
Yeah.
So
Nicely projected.
yeah, so we've got the tip up. I've got it narrow.
Yeah.
We've got the shape into oval shape. Then, so it'll look like a much proportional projected nose. So this is 7 days, and the changes that you see are dramatic because we've also had to do rib harvest for him. He had a problem of very little septal support. So septal support is very important here, especially in this point. I know it's a little bit hurting for him, so I'm not going to press now. But this is because of the fact that there is no support on the septum, that you have the tip open or less supported, or phala hua in Hindi. And that also works like a tent. So it's like the cloth there, but without the stent, then it just opens up. So we've given support from the septum. So we've also had to harvest the rib for that. And besides, we've also done osteotomy. Why? Because the base was broad and so was the tip. So we've given a nice shape to the nose. This is what we call as a dorsal aesthetic line, the curvature that comes from the eye. We've got that fixed into the tip, and trust me, it'll get better.
Yeah, I think swelling is there.
There's some swelling, so it's just 7 days, so it'll get even better with time.
Weeks by weeks will get better and better.
Yeah, I think for the first 1 or 2 weeks, you will see swelling really come down. Up to 4 weeks is the second phase of healing.
Okay.
Thereafter, not much will be there in terms for a third person to see, but healing will be happening from inside.
Okay.
Till for 6 months, later on, you will start feeling the nose like how you felt before surgery. That's when you know this 100% total healing.
Yeah.
So it takes a while. Some patients tell me 4 months, 5 months, some even tell 6, 7 months.
Yeah.
The more you do, the longer it takes,
Yeah.
right? Also, we've taken rib for you, right? You want to tell our subscribers how that experience was? I have explained like a million times, zillion times, and we keep telling our patients and telling our subscribers,
seen,
doctors are scared.
Yeah, so I've seen one of your video, you have answered a lot of questions been asked on the rib harvesting. So trust me guys, for me personally it was not painful at all. Till now I'm not feeling any pain. First 2 to 3 days, little bit while moving around, a little bit of pain. So that time I used my left hand to wake myself up.
Yeah, I saw you
and,
resting on the left hand.
But now I can use my core a little bit more better to wake myself up. So I'm not feeling anything such pain. But again, we have to be very careful, right?
Yes, the main concern people have are like, can they get back to normal life? There's another guy who just come from army before yours. He was like, "Nay, I'm in army, so nothing happens because we're just taking a small piece from a big rib cage, and it's so harvested that it basically leaves no residual deformity except a scar."
Yeah.
Now that scar also is not visible in women because we put an inframammary incision, so which is like absolutely difficult to look for, and for men it can be like a small line. That's the only thing which will remind you that there was a rib harvested. Otherwise you can go back, work, you can do anything after 4 weeks.
After 4 weeks. So
yes.
And another main concern, this might also help the subscribers. I am a fitness background, so if I want to resume to my workout, a lot of squats, and so how long should I wait?
So I think for doing anything that involves your pec muscles, because the muscles is just beneath that, you got to wait for 4 to 6 weeks.
4 to 6 weeks.
Same for the nose, I recommend, because what happens is when you exercise or work out a lot, I don't recommend swimming also, because what happens, water goes inside, pressure varies, so you can have bleeding. One simple thing that really causes a lot of panic. So by avoiding stressful activities, including exercise for the first 4 to 5 weeks, you make sure that the nose is in better shape for healing. Now second important point, the rib we have harvested from here. So this is the donor site. The donor site heals faster, quicker, better than recipient site.
Okay.
This is the site where the bone has to fuse. That takes longer. So therefore, I still think you got to take more care of your nose than the rib. But the technical aspects of harvesting a rib is not easy. I'm not saying it's easy, but if you can do it precisely, then it's really not a big issue at all. So considering now that we've got a proper rib harvest and we've got a proper rhinoplasty done, so anyways 4 weeks in your case.
Yeah.
I know it's hard. I told you 4 weeks in the first day.
Yes. I'm gonna take a little longer also. Just
That should be the attitude, because
Yeah.
in case I've seen when patients try to say, I'm fine and do something, if something goes wrong, then even if it's one episode of bleeding, lot of alarm.
Yeah.
Because you're in another city or even the same city, calling, Arey, what happened? 2 drops of blood has come. Will that become 20 drops? So best is to be cautious.
Yeah.
And then you prevent the whole episode, and then
Yeah.
you get good to resume all activities. All right?
Just wanted to tell.
Yeah, everything.
So-
we want people to tell. We find it difficult for patients to talk. Tell
So
us.
I've been following Dr. Sunil sir like since for a few years, and then trust me, he is the best in the business. So this is what I want to tell. Then he is best.
Thanks a lot for the kind words. And I didn't make him tell you that.
Yeah. No. This is my own word that comes within.
Thank you. Thanks a lot. Yeah, we're also having a good team, right? As you can see. I hope you didn't have many issues or any issues with anybody. Everything was relatively smooth.
All good. All are sweet. Very friendly. Especially the doctor and nurses. All good.
Thank you so much. Thank you so much. Right. So we will send you now because we don't have much time.
Yeah.
He's leaving today evening. So we still have to take those sutures off in a hurry. Right? Fear.
Yeah.
In the heart of heart, they're happy. But they find it very difficult to express themselves. Most of them, especially women, but even men. Then what happens? They go back, and then a lot of them in the review tell us, we are happy. They put me on Instagram.
I'm used to crowd work because I do workshop. I train I meet 700 people in a week. I train them.
Wow, so you're having the confidence to do that.
Yeah. So
Also, one thing is confidence. Another thing is, I think the mentality also of the patients, that till it doesn't heal well, they're a little skeptical.
yeah. But I know, like this is, what I'm seeing now is good, despite of having swellings. But I'm like, I can imagine after the swelling.
Yeah, be in touch with us. Anyway, we're in Bangalore, so it's easy for us to be in touch.
Yeah.
Baby, yeah? Yes.